Hello everyone, I am Dr. Jaya Kanekar and welcome back to Mind Matters. So today we're going to talk about anxiety disorder. Anxiety disorder is like an umbrella term. It covers a lot of different disorders and we're going to speak about a few. Now let me first explain what is the difference between being nervous or being anxious and having an anxiety disorder. So like any other emotion, like when we feel sad, we feel happy, we feel angry, like any other emotion, being anxious is also an emotion and it is very natural to feel anxious under certain circumstances. For example, if we have to answer a job interview. So when we are up for the job interview, we are preparing for it, there will be some amount of nervousness, some anxiousness in our mind as to whether we are fully prepared for it, how is it going to go, is it really okay, are we going to do well? All these questions will come up in our mind and we will feel a little anxious. Then when we go for the interview, when we are sitting outside, we are waiting for our turn, that is when we are feeling really anxious. We are really worried about it and our nervousness is at its peak at that time. Then when we enter inside, we are still feeling very anxious about it, but now we are in the flow. The recruiter is asking us questions, we are answering it, and then we are feeling confident as time goes by that okay, this is not that bad, I am actually doing quite okay in this interview. And once we are done with the interview, we come out and we feel that we have done well. Immediately all that anxiousness goes down. We are now completely calm, relaxed. In fact, we are feeling a little happy that okay, we did this job interview and everything went well and now things are all going to turn out fine for me. Most likely I will get this job and I will do good. Now in this particular scenario, you are going through different levels of nervousness. And this nervousness is actually helping you to perform better because it is keeping you focused on the job interview. It is helping you prepare. It's making you feel that look, I cannot really take this in a very chalta hai manner. I have to prepare for this. So you are actually preparing well. You're focused. Your concentration is at its peak. When you go in for the interview also, you are fully concentrating on what the recruiter is asking, what your answer should be, and you are doing a good job. And when you come out, you are completely relaxed and fine. So this is a range of normal emotion wherein you're worried about something, some stressful event that is going to come up, and then you go through it, and once it's done, you feel completely fine and relaxed. But if you have an anxiety disorder, then you are not able to relax even after the event is over, which means that you are constantly stressing about how it will go, or even after it is done, you're like, okay, now what will happen? What is going to happen? Have I done this? Have I done that? You're overthinking about all the things that have gone wrong, even if it is very minor and it is to be expected in any interview, but you are still constantly stressing about it. So when this happens, when you are not able to let go of that anxiousness, when you are constantly feeling like on edge, you're constantly agitated, nervous, that's when we say it is an anxiety disorder. So an anxiety disorder is when we experience excessive fear and anxiety, and it is way beyond what would be the norm for that particular situation. It also leads to certain behavioral changes in response to this anxiety, and these symptoms are severe enough to result in a disruption in our day-to-day life, whether it is work, whether it is relationships, or whether it is our day-to-day events that we face. Now, like I said, anxiety disorders is an umbrella term. It includes a lot of different disorders like generalized anxiety disorder, agoraphobia, panic disorder, a lot of other conditions that we will get to. Now today let's talk about generalized anxiety disorder. Generalized anxiety disorder is when you are experiencing a free floating kind of anxiety which is evident in every aspect of your life. So there is nothing that you can pinpoint it on. You cannot say that this particular thing is making me anxious or that particular thing is making me anxious. It's like constantly I'm anxious, constantly I'm nervous. I am just unable to relax. All the time there is this free floating sense of worry and nervousness in my mind. Or it is like there's excessive worry about negative outcomes in almost every aspect of life. So you can pinpoint and say that, okay, I'm worried about this or I'm worried about that, but those points almost encompass everything that's happening in your life, and you are constantly worried about the future. So how is this going to go? How is that going to go? Will I get this job? Once I get this job, am I going to be good at this job? Will I get promotions at this job? Will I be able to function well? Will I get a further job, which is, will I get a better job the next time? All these things. So here you are not able to control your emotions as to just keeping it limited to what is happening right now. You are so worried about negative outcomes in almost every aspect of your life. That is known as generalized anxiety disorder. Now, what are the symptoms that we see in somebody who's having generalized anxiety disorder? So first, as I explained, there will be that constant feeling of anxiousness or nervousness. You're constantly feeling like you're on the edge, okay, and you're just not able to relax. Along with that, there will be difficulty concentrating. You are not able to concentrate because obviously your mind is crowded with so many thoughts. You are so anxious about so many different things that you are just unable to focus. Because of this also we experience irritability. We are constantly irritable because we are just unable to relax. So any small thing that's happening around, which generally would not trigger us if we were not having anxiety, then that is also a trigger. And because obviously things are constantly happening around us and somebody or the other is constantly demanding our attention, we are constantly irritable. This is also accompanied by sleep disturbance, most likely because it starts with overthinking. So the person is constantly overthinking. He is unable to relax even at night when he's going to bed. So you are not able to initiate sleep because he's just constantly thinking about all the things that could go wrong tomorrow, or all the things that have already gone wrong today or yesterday. So because of this, the person has sleep disturbances. There is this constant feeling of being on edge, like that thing that you are, something is going to go wrong now, something is going to go wrong now. You are just unable to relax, you're just unable to feel that, be in the moment, something nice is happening around. I'm enjoying with my friends, I'm out for a movie, I'm out shopping, I'm having a good time, but I am constantly on the edge. I feel like something is going to go wrong at this moment or the next moment or sometimes. So I am just waiting for something bad to happen, and because of that I am not able to relax at all. Most of the times people who have anxiety disorder present with physical symptoms. Now the most common physical symptoms that they experience is chest pain, tightening in the chest, palpitations, sweating. Okay, so these are the kind of common symptoms that they will experience, and then these kind of symptoms will take them to a cardiologist or an endocrinologist. Now obviously you have to get yourself evaluated by a physician, cardiologist or endocrinologist first. That goes without saying that all your investigations need to be done, because if somebody is having thyroid disturbances or somebody is actually having a heart condition, it can present in the very similar way. So you have to get yourself examined by a specialist. But after being examined by a specialist, if the specialist says that look, all your reports are okay, everything is fine, you don't have a cardiac condition, you don't have an endocrinological disturbance, there's nothing wrong physically with you, then we have to consider that this could be caused by anxiety, and what you're having is an anxiety disorder, and once we treat the anxiety disorder, the symptoms will subside on its own. Another common symptom experienced by people who have anxiety is they will have constant GI disturbances. So there will be nausea or vomiting or diarrhea, or they can even have frequent urination. Now because of this, they will land up with a physician, gastroenterologist or a urologist. Once all of these have been evaluated, once the urologist or the gastroenterologist or the physician says that all your symptoms have been evaluated, all your tests are fine, and it does not look like there is a physical cause for your symptoms, then we have to consider that these are also symptoms of anxiety. Mostly they will also experience this motor restlessness, agitation, not being able to sit in one place, back pain or pain in the lower back, because that is also caused by tightening of muscles, which happens during anxiety. So because of that, they will have this spasm, and then they will think that something is wrong. I'm having backache, my body is hurting, or I'm constantly having these headaches and all of these symptoms. When you meet your doctor and they say that there is nothing wrong physically, but you are definitely experiencing these symptoms. It's not like you are making up the symptoms. You are experiencing all of this, but physically they are not able to pinpoint any cause for you to have all of these symptoms. That is when we consider that you may be having an anxiety disorder. So once you meet a psychiatrist and the psychiatrist evaluates you and sees that okay, you have anxiety disorder, and we start treating the anxiety, you will see that automatically all the physical symptoms will also subside. Now, should we be worried about all these physical symptoms if they are there for a day or two, if they are transient? No. If these symptoms persist, if they persist for days, for weeks, for months, and you've gone to your doctors and the doctors have said nothing is wrong, they have given you symptomatic treatment for the same, and it gets better for a few days and then it is not better anymore, then you have to consider that this is an anxiety disorder. So when somebody is going through all of these anxiety symptoms, whether it is psychological or physical, it will cause a lot of disruption in your day-to-day functioning, and we see behavioral disturbances in the form of avoidance or procrastination. Now this is done to avoid getting into the stressful situation. Okay, like somebody who has an important exam coming up but is not able to study. Why they're not able to study? Because they are so anxious, and they are like, if I start to study, then I will get even more anxious because already I'm worried, and then I will open the book and then I will say, oh, I don't know anything. So how will I manage? Or if somebody is looking for a job, then they will avoid going in for job interviews. So this kind of avoidance or procrastination is a coping mechanism that somebody with anxiety disorders comes up with. It is like, it is easier for me just not to do it than to go through the entire anxiety when I'm doing it. So at every step, I'm going to be so super anxious that I just don't have the energy to deal with it. So I will not do any of it. Okay, so this avoidance and procrastination, these are the coping mechanisms that somebody with anxiety disorder comes up with. But obviously that is not the way we want to live our life. We don't want to live our life cooped up in the house. We don't want to live our life where we are giving up on so many opportunities because we are feeling anxious, because we are worried whether we are going to be able to fulfill those responsibilities if we actually get those opportunities. So I would suggest that if you have any of these symptoms, or you know anyone in your neighborhood or among your friends or acquaintances who have these symptoms, then please consider telling them that they would benefit from meeting a therapist, from meeting a psychiatrist. And definitely once we start treating the anxiety, the symptoms go away. It really is sometimes it almost feels magical to the patient, because they have been suffering with this for so long, and then all of a sudden they're like relaxed, they're fine, they can manage their day-to-day activities so easily, they look forward to doing something new, and it just kind of gives them a whole different perspective on their life. So if you have any of these symptoms, or if you see anybody around you having these symptoms, please encourage them to meet a therapist. I hope you have found this video informative, and if you have any questions regarding the information given in this video, please feel free to drop a comment below, and I will try my best to answer it as soon as possible. Until then, until the next video, please remember to be kind to your mind. Thank you.